This lecture covers the anatomy of the male reproductive system. Here is a labeled diagram of the important parts of the male reproductive system. On the following slide, you will find the same diagram unlabeled for practice. Were you able to label this diagram without help? If not, you may want to practice a bit more. Let's talk about the parts of the male reproductive system and their functions. The testes are the place where the production of sperm cells and hormones occur. Testes, T-E-S-T-E-S, is the plural. T-E-S-T-I-S is the singular form. The epididymis is the place where the sperm gain the ability to swim, and this takes about 20 days. The vas deferens are the tubes that carry the sperm from the epididymis to the urethra, and the accessory glands produce secretions that are important in the transport of sperm cells, and they include Cowper's glands, the prostate, and the seminal vesicles. Here is a labeled diagram of the testis. Following this slide is an unlabeled diagram. See how well you've learned these parts. Well, how did you do? Remember that the testes is the location of sperm production and the production of hormones. The testes are held in a pouch called the scrotum. The testes originate in the abdominal cavity, but prior to the 8th month of development, they should descend into the scrotal sac. The seminiferous tubules are small tubes that make up the testes, and this is where sperm production occurs. Surrounding these seminiferous tubules are the interstitial cells of Leydig, which is the place where testosterone is produced. This is a microscopic slide of a seminiferous tubule. You should have seen this slide in the laboratory. In this microscopic slide of the seminiferous tubules, you can see that in between the tubules are triangular clusters. These are the interstitial cells of Leydig and the location for the production of testosterone. Here is another view of the interstitial cells of Leydig. The primary male steroid hormone is testosterone, and it's produced in the testes. As men age, levels of this hormone tend to decline. Testosterone plays a role in many important functions that include sperm production, bone and muscle growth, facial hair growth, thickening of the vocal cords, cell growth in the skin, and the stimulation of oil glands. There is a condition known as cryptorchidism. Crypto means hidden, and orchio refers to the testicle. So cryptorchidism is a condition in which the testicles are undescended. Usually they will descend within the first 2 years, but if they do not, then surgery would be necessary. And the reason surgery is necessary is because the temperature is too high in the abdominal cavity and the sperm cannot survive here. If it's not corrected, the result would be sterility. This slide shows you a case of unilateral cryptorchidism, which is where one of the testicles has descended into the scrotal sac, but the other has not, and it remains in the abdominal cavity. 3 important factors play a role in sperm production. They are cryptorchidism, tight pants, and long-distance running. Take a look at the blog by Dr. Hilary Jones on the right. The problem in all 3 of these cases, cryptorchidism, tight pants, and long-distance running, is that they will raise the temperature of the sperm cell, making it non-viable. Testicular cancer affects about 1 in 20,000 males. It is the most common type of cancer in men ages 15 to 35. Mumps can increase the risk of testicular cancer, but the most important risk factor is cryptorchidism. The most common sign of testicular cancer is a painless solid mass in the testis. The good news is about 90% of those that are detected and treated early are cured. The best way to detect early is by self-examination. For men with cancer that has not spread beyond the testicles, and that's known as stage 1, the survival rate is 99%. For men with cancer that has spread to the lymph nodes in the back of the abdomen, and these lymph nodes are called the retroperitoneal lymph nodes, their survival rate is about 96%. The scrotum is the sac that holds the testes. There are two muscles, the cremaster muscle and the dartos muscle, whose job it is to regulate the temperature in the testes and to be sure that the temperature is not too high or too low. If the temperature is too high, they will lower the testes. If the temperature is too low, they will raise the testes closer to the body. The cremaster muscle also functions to retract the testes to guard against injury. The epididymis is the place where sperm cells go to mature. It's actually a collection of small tubules that transport sperm from the testes to the vas deferens. Inflammation of the epididymis is a very painful condition, and it's known as epididymitis. Remember, the ending itis means inflammation of, and it's usually the result of trauma or infection. Hopefully you can tell that the epididymis on the left testicle is of normal size. That of the right testicle is very swollen and demonstrates epididymitis. The vas deferens, also known as the ductus deferens, are the tubes that carry the sperm cells from the epididymis, where they've been maturing, to the outside of the body. Remember that the sperm cells are produced in the testes, go to the epididymis to mature, and then pass through the vas deferens, where they mix with seminal fluid and form semen. So semen is the fluid containing sperm cells and male secretions. It is sticky because it contains a sugar, and it provides a medium of transport and nutrients. I mentioned the term accessory gland. An accessory gland is a gland that contributes to reproduction, but the sperm cell does not pass through it. It's in the accessory glands that male secretions are produced, and those accessory glands are the seminal vesicles, Cowper's glands, and the prostate gland. A vasectomy is considered a permanent method of birth control. Although the testicles continue to produce sperm, the sperm are reabsorbed by the body.